In this video, I'll be giving you a book review on Why We Get Sick by Dr. Benjamin Bikman, PhD. It looks like a really valuable patient education resource, especially for patients who are struggling with insulin resistance, for diabetes, for PCOS, and even risk for Alzheimer's. If you've seen the book and you thought it might be useful, but you haven't had a chance to read it yet, I'm here to help. Hey, Steve Goldring here from SimpleHormones.com. I help hormone optimization providers and medical practitioners save time and frustration in educating their patients. Time is your most precious commodity. There are so many patient education resources out there that sometimes it's hard to know which ones you should invest your time in and pass on that information to your patients. In this video, I'll be reviewing Why We Get Sick chapter by chapter. I'll focus on the paradigm shifts, the big changes in our thinking about what causes disease. Stick around to the end of the video and I'll share my top 3 bullet points, 3 key takeaways for patient health and wellness. I'd love to hear about your favorite book or resource in the integrative and functional medicine space. Drop a comment below and let me know, and maybe I'll review it and spread the word so we can all benefit. Bikman has some very interesting paradigm shifts that start with the discovery that insulin resistance is a direct cause of hypertension, dyslipidemia, atherosclerosis. Bikman makes the case that insulin resistance is not just present in disease, but it's a major cause of disease. Bikman has a list of questions about whether people have insulin resistance or not, starting with, do you have fat around your belly or more fat than you'd like? Do you have high blood pressure, a family history of heart disease? Do you have high levels of triglycerides? He asks, do you have a family member with insulin resistance or type 2 diabetes? And do you have PCOS or polycystic ovary syndrome? It's a topic that I'm very interested in. I'm working on a patient education resource just about polycystic ovary syndrome. Insulin resistance has been diagnosed in patients as young as 4 years old. It's extremely common in young people, and the obesity epidemic may actually be synonymous with insulin resistance. Of course, there are 2 types of diabetes, and Bikman goes over the 2 types. They both involve high blood glucose levels or hyperglycemia. Beyond hyperglycemia, type 1 and type 2 diabetes are completely different diseases, but we've basically lumped them together by calling them by the same name, diabetes. We're committed to think of diabetes as a disease of hyperglycemia, basically ignoring the concept of hyperinsulinemia. Bikman believes that people with insulin resistance are underdiagnosed, partially because insulin is a little harder to measure in the bloodstream, or at least it was at the beginning. Blood glucose is something that's easy to measure, and so blood glucose became the de facto measurement that we could look at in both type 1 and type 2 diabetics. He makes it clear that diabetes is first a disease of insulin resistance and second a disease of hyperglycemia. The thing about insulin resistance is that it won't kill you, but it will lead you down a pathway toward diseases that will kill you. Salt intake is the villain in our battle against hypertension, which ultimately can lead us to atherosclerosis and heart disease. Well, Bikman makes the point that salt is a proximal cause of hypertension. Before salt comes elevated levels of aldosterone, and before aldosterone comes insulin resistance. I'll be taking a look at a book by James DiNicolantonio, Salt Fix, that goes into much more detail about salt as the villain in hypertension. Bikman makes the point that dietary cholesterol may not be the real reason behind dyslipidemia. One of the villains that's gotten a well-deserved reputation for causing disease in the last few years is inflammation. Inflammation is very clearly at the root of many of our chronic disease problems, including heart disease. The paradigm shift here is that insulin resistance can actually increase inflammation. Research has very clearly shown in the last 10 years or so that there are 2 primary reasons for Alzheimer's disease developing in patients. Number 1, insulin resistance. Number 2, inflammation. That goes against what's called the amyloid hypothesis, which is the idea that the buildup of amyloid plaques in the brain cause Alzheimer's. Those may be a symptom or a result of Alzheimer's, but they're not necessarily the cause. Multiple other things are caused by inflammation, and there are also multiple other causes and risk factors involved in Alzheimer's, but the two primary ones would be inflammation and insulin resistance. I mentioned earlier PCOS, or polycystic ovary syndrome. PCOS has been thought to be associated with insulin resistance. One of the major hallmarks of PCOS is masculinization that's caused by high levels of testosterone, much higher than women normally have. Ovaries, when bathed in high levels of insulin, produce much higher levels of testosterone. And the reverse is not true. It's become clear that insulin resistance and its hyperinsulinemia is what causes the high testosterone that leads to the PCOS symptoms like masculinization. High testosterone levels are also what lead to ovaries not ovulating and the infertility that's associated with PCOS. PCOS patients have a much higher risk for breast cancer and uterine cancer, as well as endometrial cancer because of endometrial hyperplasia. Cancer has a lot to do with insulin resistance. There are three cancers: breast cancer, prostate cancer, and colorectal cancer. Those have been called obesity-related cancers. They are very responsive to the hormone insulin. When patients have higher levels of insulin, those cancers tend to grow faster. They also tend to thrive when there's higher levels of glucose in the blood. I also plan to review Jason Fung's book, The Cancer Code, which goes into a lot more detail about how cancer feeds preferentially on glucose in an anaerobic type of respiration, and it needs much more glucose and thrives in the presence of insulin. We've always thought of alcohol as the primary cause of fatty liver disease. Well, in the last couple of decades, non-alcoholic fatty liver disease has become very prominent, especially in patients with type 2 diabetes. Sugar builds up in the bloodstream, and that sugar is converted into fat, which is stored first in the liver as fatty liver. That causes elevated liver enzymes and ultimately causes a breakdown of the functioning of the liver. Another issue is fructose, or fruit sugar. Fructose is a faster path to fatty liver disease than even regular glucose would be. Bikman talks about a paradigm shift regarding metabolic syndrome, including central obesity, high blood pressure, and insulin resistance. But insulin resistance seems to be at the core of metabolic syndrome. The problem is the self-perpetuating cycle. Insulin resistance leads to more insulin being produced. More insulin causes more fat, which causes more insulin, which causes more fat. Insulin resistance is the real problem in metabolic syndrome. Bikman goes over the causes of insulin resistance. He talks a little bit about genetics. He also mentions a lot hormonal causes of insulin resistance, especially the loss of estradiol at menopause, the loss of testosterone in men over 40 or 50, and the loss of thyroid hormones. Multiple hormones contribute to the loss of insulin sensitivity as we age. Lifestyle factors also contribute to our loss of insulin sensitivity. A lack of sleep, air pollution, smoking, the food we eat, which we'll cover a lot later, BPAs, which are contaminants found in plastic, artificial and natural sweeteners, a lack of exercise. Well, our paradigm for the last 50 or 70 years has been that drugs are the solution to diabetes. Most drugs that we use for diabetes don't work on the real problem, the insulin resistance. For example, sulfonylureas, they may drop blood glucose, but they actually increase insulin secretion, which ultimately makes insulin resistance worse. There's really only one drug that has much promise in treating diabetes from an insulin resistance standpoint, and that's metformin, which not only decreases blood glucose, but also decreases insulin resistance. So if drugs are not the solution, what does help reduce our insulin resistance? Exercise is one of the major tools we have in the battle against insulin resistance. If you could only do one type of exercise, resistance would be the type to go for. Resistance is better than aerobic. High intensity is better than low intensity. Complex is better than simple. He also says that the type of exercise that you'll do is the best type of exercise. Of course, the major tool in our battle against insulin resistance is the foods we eat. The old paradigm has been to eat less and move more, mainly in terms of losing weight, And that's also the advice that many diabetics have been given. Eat less, move more has helped people lose weight temporarily, but it's not really sustainable in helping people keep that weight off. Reducing calories, according to Bikman and the research he cites, is not a good way to lose weight or treat insulin resistance. What he does say is we need to increase our fiber, we need to decrease our carbohydrates, we need to maintain an adequate protein level, and we need to fill in with fat that increases our feeling of satiation. Bikman also addresses time-restricted eating and intermittent fasting as key tools in the battle against insulin resistance. Those can help to reset our metabolism. Research is clearly showing that insulin resistance is the cause of heart disease, of neurological disease, of reproductive disease, of the metabolic syndrome, and many other problems that plague our modern world. Insulin resistance is within our control. We can make a difference. We can do some things that are simple and easy to start with. I would strongly recommend reading this book. It's concise, it's clear, has a lot of great useful information and helpful references to show you how to teach your patients about insulin resistance. I also strongly say you should recommend this book to your patients. It's easy for lay people to understand. It does have some technical medical information necessarily, but I don't think your patients will be too bogged down in that. It will be great for them to really have an understanding of the root causes underneath some of these disease states. Okay, so here are the top 3 bullet points from Why We Get Sick that patients can use to improve their health and wellness, whether you buy the book or not. Insulin resistance is the cause of many, if not most, of the major diseases that plague our world today. Diabetes, heart disease, Alzheimer's, and polycystic ovary syndrome. Since somewhere around 88% of all adults have insulin resistance, you probably do too. There are some simple steps that you can take to start reversing or preventing insulin resistance. Things like get moving, regular exercise, eating smart. That involves reducing carbohydrates, maintaining adequate protein, and filling in with fat. Get good quality and quantity of sleep as many nights as you possibly can. If you like this video, check out some more interviews with Ben Bikman about insulin resistance and its role in causing disease. Thanks so much for watching. Be sure to subscribe to my channel to hear about any time I upload a new video.